This is our solution to treating substance use disorders within the carceral system, an addition and revision to our ethical argument from the last video.
If MAT in carceral systems is implemented as we have suggested, it would significantly relieve the burdens and suffering not only of the individual with SUD, but also their family members. Family members would have peace of mind knowing that their loved one has access to adequate, evidence-based treatment to help alleviate their disease, and that they will be at a much lower risk of overdose or death once their sentence ends. These programs would also prevent the burden on the would-be victim of crimes. Providing MAT during incarceration would lead to an increased number of people with SUDs receiving treatment. This could translate to a decrease in crimes committed as a result of SUD. For example, thefts committed as a source of income to obtain one's substance of choice. Therefore, this treatment could indirectly prevent more people from falling victim to SUD-related crimes. While it is difficult to find empirical data on the relative cost difference of delivering MAT in prisons versus not doing so, one example of its cost effectiveness is Snohomish County Jail, Washington. According to a National Sheriff's Association report on jail-based MAT, at this particular institution, quote, the overall cost of the medication is less than the amount the jail paid for the medications previously used to ease withdrawal symptoms. A 2023 study estimated the cost-effectiveness and overdose mortality rates based on a Massachusetts policy, which requires automatic SUD screening and offering medication. The study showed that offering all three types of medication was associated with a higher reduction in overdose deaths and was less costly compared to only offering naltrexone. Overall, they found that the 3-MOUD strategy was cost-effective at $7,252 per quality-adjusted life year gained. While it is inevitable that these programs will require funding, research supports that they are a cost-effective way to save lives.
So this is a very brief map of the options or path an individual might take if MAT was offered. So they can always choose not to take it, but that is ethically permissible because it is always up to their personal agency to do so, and we would never want to force that on anyone. But if the individual does receive medication and therapy, there are many paths that they can take outside of that. One would be at least they have reduced withdrawal symptoms, so they're experiencing less pain, which is morally permissible and which is a better outcome than before. They could become totally clean or abstain from using drugs, and this would have many positive impacts on their life, a few including job impacts, family impacts, financial impacts, things like that. And then if they get out of prison, they can choose to continue their treatment and aftercare, which could ultimately lead back to those positive impacts. So all of these results are morally permissible and better situations than the current situation or other ones suggested. Now, to address the counter-argument that someone wouldn't want their hard-earned tax dollars going towards criminals. So we have three main points to this. The first one is that in the long run, it would hopefully decrease recidivism. So it would lower the demand for the carceral system, which means that there are less resources needed for them to pay more in the future. Because if less people go back to jail, there's less prisoners, that's less tax money. So it indirectly lowers taxpayer burdens, and it provides stability for treating SUDs. Also, criminals are also sick people, and labeling someone solely based on one factor of their life does not go along with our ethical argument, and so we have to make sure we're treating everyone with dignity, and we address and understand that these people might not have treated others with dignity, but we're going to treat them as sick people, not as criminals, because they have a disorder. And then 3, the system serves you too, so you never know when you're going to be in a situation, maybe not with a substance use disorder, but just, with the law or anything financially. So the system should work ethically so that it works ethically for everyone. And you have to think about yourself and how that affects even just people around you, family members, friends, coworkers, everything like that. So those are our main responses to the counterargument.